When it comes to the world of oncology, few developments have been as impactful as HCT, Hematopoietic Cell Transplantation. This groundbreaking procedure continues to drive impressive growth in both patient volume and revenue. But here's where it gets even more fascinating. The numbers aren't just climbing, they're accelerating. What does this mean for the future of cancer treatment, and how will it shape the healthcare industry as a whole? Let's dive into the details and explore why this trend is capturing so much attention. First, let's address the elephant in the room. Why is HCT gaining such momentum? The answer lies in its effectiveness. For decades, transplantation of hematopoietic cells has been a cornerstone in treating various blood cancers, including leukemia, lymphoma, and multiple myeloma. However, recent advancements in technology and medical protocols have significantly improved success rates, making the procedure more accessible and appealing to a broader range of patients. This surge in adoption is directly tied to better survival outcomes and quality of life for those undergoing treatment. And this is the part most people miss. It's not just about the science. It's also about the growing trust patients and providers place in these therapies. From a financial perspective, the rise in HCT procedures translates into substantial revenue growth for institutions offering these services. Hospitals and specialized treatment centers are investing heavily in cutting-edge infrastructure, training staff, and expanding their transplant programs to meet the increasing demand. This investment cycle creates a positive feedback loop. As facilities improve, they attract more patients. It's a win-win situation for both healthcare providers and patients. But is it sustainable in the long term? Now, let's talk about some of the challenges that come with this rapid expansion. One concern is whether the current healthcare system can keep up with the rising demand without compromising quality. For instance, do we have enough trained professionals to handle the influx of cases? Are there sufficient resources to ensure every patient receives personalized care? These questions spark debate among experts. Some argue that the industry is moving too fast, risking burnout among medical teams and potentially diluting standards. Others believe that innovation will naturally fill these gaps over time. Where do you stand on this issue? Share your thoughts in the comments below. On the regulatory side, transparency remains critical. While analysts and investors closely monitor the performance of companies involved in oncology treatments, it's important to note that past achievements don't guarantee future success. No one can predict with certainty which investments will yield the best returns or how specific stocks might perform. Therefore, anyone considering entering this space should conduct thorough research and consult trusted advisors before making decisions. This cautious approach isn't unique to oncology. It applies to any high-stakes industry where innovation meets uncertainty. Lastly, let's address a subtle but controversial viewpoint. Could the focus on revenue growth overshadow the primary goal of improving patient outcomes? While profit motives often drive innovation, critics worry that excessive commercialization might lead to ethical dilemmas. For example, what happens if pricing becomes prohibitive for certain demographics? Should governments step in to regulate costs? These are complex questions with no easy answers, but they underscore the importance of balancing business interests with humanitarian values. In conclusion, the continued growth of HCT in oncology is undeniably transformative. It offers hope to countless individuals battling cancer while reshaping the economic landscape of healthcare. Yet, it also raises important questions about sustainability, ethics, and equity. As we move forward, finding the right balance between progress and responsibility will be key. Do you think the industry is doing enough to prioritize patients over profits? Or is there room for improvement? Join the conversation and let us know what you think.